We're joined right now by Republican Congressman Connie Mack of Florida and Democrat Congresswoman Allyson Schwartz of Pennsylvania. Congressman Schwartz, let me start with you. I was looking at the makeup of your district, and you have somewhat of a moderate district in North Philadelphia area. Are you worried about your support for this health care reform and the people voting a year from now?
Well, I represent an urban and suburban district, and what I hear from my constituents is I think what most Americans are saying, which is we have got to see some action to bring down the cost, the rising cost of health coverage, to make it more accessible to families and to businesses, and they want to see action, and they certainly want to see some greater consumer protections. So in fact, when they buy insurance, it's meaningful coverage. So that they're saying take action. We've been talking about this for a long time. It's time to really move forward, and again, making sure consumers are protected, there's greater access to meaningful coverage, and I think they want us to act responsibly, and that's what we're going to do.
All right, so you're not going to change, but Congressman Mack, is anybody else, do you hear anything around the water cooler in the hallways of Congress about people thinking carefully about how they're going to vote regarding the election next year on them?
Well, I think there's a sense around here that it's not over yet, that this really doesn't have anything to do with whether or not they have the Republican votes, because Republicans aren't going to vote for this. It's a bigger fight inside their party, trying to get the votes in their own party. And I would make this suggestion: if it's that hard to get your party to support this bill, then maybe it's not a good idea. And I think the American people have spoke out loud and clear that they do not want the government in between them and their doctor. They do not want government to run the health care system. That they want to see things like tax incentives, not fines. They want to see tort reform. They want to see association health plans. They want to see more access to coverage, but they don't want to do it at the cost of small businesses and families.
Well, if I may answer that, I'd be happy to, which is why, in fact, what we are doing is a very uniquely American solution, which is relying on the private sector, making sure that consumer protections, and so if you have a pre-existing condition, you can still buy meaningful coverage. And this is really a shared responsibility. This is government's going to be there to protect consumers and to provide greater access. But this is clearly an individual, family, private sector, really initiative, and we're doing it in a very reasoned and moderate way, and there are enough Democratic votes
Congressman
to vote for
Schwartz, you say we must move forward with this, but clearly the Democrats are still divided on this issue. I mean, what's the master plan to move forward if you don't have the full support of even your own party?
Well, we do have the full support of our party. What has been really interesting in this is that we have had a very full debate, and that is really what we do in Congress, and certainly what we should be doing. We would have liked to have some help from the Republicans, because I know they also represent people who are demanding this kind of protection and access to health coverage. But what we've done is certainly have a very dynamic debate within the Democratic caucus, because we do represent such a broad section of this country, in urban, suburban, rural areas. Really, some more conservative, some more liberal, and we've really come up with what I believe is a very strong, reasoned, moderate proposal that's going to really benefit both businesses and families in this country.
Congressman Mack, I also, in my spare time, host a radio talk show, and I'll tell you, the debate has gone all over the content about health care, government health care options, killing granny, all those things, but it now seems to have shifted to how are we going to pay for this? And nobody's believing the numbers. What's the debate in Congress? Is it about the health care itself or about the cost of this program?
Well, I would hope it would be both, but right now I think most people are focusing on the cost, which is an important part of the debate. How much is this going to cost people? What does this mean between the relationship between government and the individual? I think this fundamentally changes that relationship in a negative way. And I do think that Republicans, we wanted to be part of this solution, but we were shut out. If you start with a bill that's a government-run health care, it's a non-starter. And from the beginning, this has been a government-run health care plan that was going to pit government and put the government between the individual and their doctor, and that's just a non-starter. And I think the American people have spoke loud and clear. Whether it was yesterday on Capitol Hill or all across the country in town hall meetings, letters, calls to members of Congress, They do not want a government-run health care. The Democrats are going to push that down the American people's throat without any kind of real support from Republicans. And I think it's a big mistake. And I think at the end of the day, they're going to see how the American people feel about this come next November.
And if I may, I just certainly want to answer the question in a different way. There's no question, as the representative knows, we in fact are doing so much to protect the patient-doctor relationship. There's no way we get in the middle of that. He knows that. And the Republican option that they've actually put forward really is expensive and does nothing to really address
Government will run your health care, and you will not have the choice.
Thank you both very much. He's shaking his head. She's nodding her head.
You're welcome.
Congresswoman Schwartz, Congressman Mack, thank you both very much for being with us today.
Welcome.
Meantime, we have some breaking news coming in. Our colleagues at Dow Jones are reporting 8 people